This is one of the steps to scale, especially with your providers. You need to get on the same page with them and say, hey, look, there's no way you can see 1,000 patients, period. You can't. There's just too many things going on. So you have to rely on teamwork. So I received this question from an event that I went to over the weekend. If you have any questions, send them to questions@dralexspinoso.com, questions@dralexspinoso.com. I'd love to create a video on it, post it on my website, share it to everybody. We all elevate and improve together. So transitioning to an RN or staff other than the provider seeing patients on follow-ups, what does that look like? Verbiage, patient questions, scheduling, how is it presented to established staff? So this is one of the biggest ways that clinics actually bottleneck or stop themselves from scaling, is that they believe the provider has to see every single person. Now, it is true. The provider has to see every single person, or at least sign off on every single person if you are going to be prescribing some sort of medication or treatment, etc. However, it's not true that that provider has to continue to see that patient in person time after time after time after time, every time that person comes back. How do you present that to your staff, and how do you present that to your patient? Well, number one is really expectations. You're setting the expectations up front. When patients come into Genesis Lifestyle Medicine, they see the front desk person, the clinic director, they will do a consult with the sales staff, and all these people are usually not the nurse practitioner or the PA or the person who is actually writing the prescription. They are support teams. They might be MAs, they might just be sales staff, but they're all trained and educated in what we do, as well as trained and educated in how to sell and speak to every single one of our services. Now, once they go through a consultation, review the medical history and everything like that, then they'll bring that chart with their thoughts and recommendations to the provider. The provider will then go see the patient in person, review it, say, okay, yeah, you're accepted into treatment. Thank you very much, Mr. Smith. Do you have any other questions that I need to answer before I go? They might ask a question, one or two. Okay, thank you very much. And then they leave. And then the MA, salesperson, or whatever finishes up the sale, closes it, takes the money. The other option, that is the synchronous visit. The other option is called asynchronous. So when you're doing non-controlled substances, a person doesn't actually have to be seen directly by a provider. The provider can review the patient's chart, and before you take payment, they can accept them into care based off of the medical guidelines for their treatment. We do this a lot with weight loss therapy, making sure that we're reviewing everything and ensuring that everything is exactly the way it's supposed to be and that patient is actually accepted into care. With the follow-ups, we always have follow-ups with our support staff, MAs, phlebotomists, clinic directors, etc. And those follow-ups include weighing a patient on a scale if they're weight loss, talking to them about their treatments, asking if they would like any boosters to their injections today, B12 or ALA. If they do, then again, we go get the provider, ask them if it's okay, they're accepted into care for that treatment, it's signed off. The provider is usually signing off a prescription for 3 to 6 to 12 months. If it's a controlled substance, it's usually 3 months. If it's a non-controlled substance, it could be 3, 6, or even 12 months. For example, what could you be signing off for 12 months? Where hair restoration treatments such as finasteride or minoxidil, B12, lipoline treatments. When it comes to weight loss medications that are non-controlled, they could be signed off for an entire year if they know they have to lose 100 pounds or more. A provider knows you're not going to lose that weight in 6 months. So they might write a whole year's worth of medications, and now if there's any changes in medication, the provider again has to okay those. The initial prescription that is written by the provider might be stage 1. If there's ever any change in prescription dosing, again, an RN, an LVN, clinic director, sales team, they can't practice medicine, so they shouldn't be controlling that. You bring those changes to the provider okays them, change the dosing, chart it, make sure the provider signs off on that. Major patient questions that they have about treatments or their next steps should be able to be answered by anybody in the clinic. Are you practicing medicine? No, you're answering questions based off of what your protocols are. So make sure you have your protocols written down always when it comes to practicing. If they have specific care questions or specific questions about their healthcare with their drugs, you should elevate those to the provider and make sure the provider has a quick conversation with them, or at least you get the provider's input and answers, and make sure you document. If you don't document these little conversations, they didn't happen. When it comes to scheduling, our follow-ups are scheduled where the provider can be there for most of our treatments. However, there can be follow-up scheduled with a provider not there. Things like cool sculpting follow-ups or weight loss follow-ups that's already been written for their prescriptions, or even hormone therapy follow-ups where they just need to get blood work or things like that, where the prescriber has already written the plan out for our staff. You don't need a provider there every single time, or a provider to see that patient specifically every single time. This will help you significantly increase your volume. One of the biggest things that I see staff bottlenecking themselves is that they have the provider seeing every single patient, every single new patient, and doing the full history, physical review of the charts, etc. All this can be done usually by an MA or by a scribe or by a salesperson, and then the provider does that final qualification and signs them off into care. If you look at big companies, Ideal Image, Laserway, all of their patients are seen by sales team first. They're sold the treatment, the provider okays that treatment, and then they schedule the treatment with the provider. Many times they may not even see a provider that first visit in these larger companies. Is it legal? 100% yes. It's not illegal to do treatments that way. Controlled substances, right now, there are COVID rules in place that allow you to see people via telehealth and not have to see them in person. However, we don't do that because it doesn't make sense for us at scale to have to do borderline medication or borderline issues where we're not sure whether or not the FDA is going to approve what we do. So we always make sure we see those people in person on the controlled substances. But other than that, everything else can be done via telehealth, can be done via asynchronous telehealth visits. This is how Keeps, For Hims, Romans, all these big companies via telehealth do it, and you can do it too in order for you to scale. Presenting this to established staff is essentially talking about how you're going to scale. This is one of the steps to scale, especially with your providers. You need to get on the same page with them and say, hey, look, there's no way you can see 1,000 patients, period. You can't. There's just too many things going on. So you have to rely on teamwork. You have to rely on your support staff to know what they're doing, help get these patients on board, help get these patients followed up, and it will increase your speed when it comes to your provider. It will increase your teamwork, and it will exponentially grow your business. So that's how you can transition from the provider seeing every single person to having your support staff starting to see these patients on follow-ups, starting to do the consultations, starting to do all those things. Now remember, again, they can't practice medicine, they cannot prescribe, so make sure you have a provider or your provider is signing off, reviewing, and actually doing the qualifications for every single patient that comes in. You do not want your front desk staff or back office staff or your sales staff practicing medicine.